Welcome back. You are still watching Today here on ENCA. Now, we go back to our top story. The Gauteng Portfolio Health Committee says it welcomes the Ombud's findings and recommendations into the Tembisa Hospital after the death of businessman Shonisani Lethole there. Chairperson Rebecca Peladi-Dikhamela is here to expand on this with us. Thank you very much for joining us, Chairperson. Now, of course, we also heard reaction from Shonisani Lethole's family this week, but also they brought along about 5 or 6 other families who have very horrifying stories about the Tembisa Hospital. One of them actually talking about how she was supposed to be given a C-section because she was pregnant with twins, but because they lost her file, she lost one of her babies. So would you not say that it's more than just Shonisani Lethole with this hospital and more investigations need to be done?
Thank you very much for this opportunity. Let me start by saying we send our deepest condolences to the Lethole family to have lost their son Shonisani in the facilities of the Department of Health in Gauteng. The role of the Portfolio Committee is to do oversight in facilities of health in Gauteng. So we really are here to find out what actually happened. We have noted the report of the Ombudsman that indicated issues that happened during the stay of Shonisani in this hospital. So we feel justice was not done and proper care might have been bypassed in certain areas, and we don't agree with not feeding our patients when they are in the hospital. So perhaps it will be prudent to say we need to do more oversight to find out what other issues are affecting the patients when they're in the hospitals. So I wouldn't say there are more issues, because until they're brought to our attention when we do our oversight visit, we don't presume that there will be issues until we come and we find out what are the issues, or they are reported to us by a member of public. Then we take action to come and investigate.
It seems we've lost you a little bit there, Peladi-Dikhamela. I don't know if you can hear me now. I'll try to get another question to you. Now, the Parliamentary Portfolio Committee visiting the hospital today, and I hear that you're saying that unless issues are brought to you, you won't be able to do anything about it. But surely you need to, will your investigation, for instance, into what happened to Shonisani Lethole, for instance, maybe expand to other issues that might have occurred at the hospital? Because if other families are complaining, it means even the recommendation by the Health Ombudsman to have 19 staff members who looked after Shonisani Lethole be investigated, it probably means all staff members should be investigated, because now there are more complaints.
The issue that is worrisome in case of Shonisani is the conflicting report between the clinicians. That's worrisome as to how did this happen. And I think I will raise the issue of supervision of the staff on duty, because you cannot have 2 conflicting reports for the same patient. I mean, it's very important to note when did the patient die. Like, you need to know when did the patient die. It can't be this one says this date and the other one say that date. The other problem is lying. If clinicians are lying in records, that's a problem for us as a committee, because people leave their home with the hope that when they go to the hospital, they will get the better treatment. But lying is raising a suspicion that things were not done accordingly.
I want to expand more, Mayor, on the lying part and the withholding of information. There is a doctor, the one who certified Ntate Lethole late, about 10 hours after his death, admitting to the Health Ombudsman that he tried to falsify the information about the date to which he died, because he was aware that you're supposed to certify someone dead 2 hours after the death. He arrived the next day, about 10 hours after the death, and admitting that he tried to falsify that information. And also the fact that there were other members of that hospital who told the previous MEC that they fed him. But then when they realized that actually when he was intubated, they didn't put that tube inside his body that would feed him, and therefore he wasn't fed for 4 days. Wouldn't you say that this is a crime that probably warrants a criminal investigation?
It is not only through nasogastric tube that one can get food. There are other means of giving a person, an intubated patient, food, which I'm still also trying to figure out what happened. So the issue of poor record keeping remains a concern to us as a committee, because if it is not recorded, it means it was not done. So as a committee, the expectation from the management of this hospital is to ensure that consequences are done. Those who forge the documents, they need to be taken for consequences. And poor supervision, if it's there, it's also to be put on the leadership to say, how did this happen? Because on a daily basis, there are people who are running the wards in the hospital. It's their role to check what is going on with their patients.
Well, thank you very much. We've unfortunately run out of time. That is, of course, the chairperson of the Portfolio on Health in Gauteng, Rebecca Paladidi-Khamela.